Leadership is not about being in charge. It is about taking care of those in your charge. So inspire, collaborate, trust, and succeed. Let me introduce to my authors, Professor Stephen Shortell and Professor Arnold Kaluzny. Emeritus Professor Stephen Shortell has been widely recognized in the field of health policy and management, and he is an emeritus professor at the University of California, Berkeley, where he also served as a dean of the School of Public Health. He worked extensively on the healthcare leadership, quality improvement, and organizational performance. He is also widely recognized for his research on integrated healthcare delivery systems and accountable care organization. Secondly, Professor Arnold Kaluzny is also a professor emeritus at the University of North Carolina at Chapel Hill. He was previously affiliated with Gillings School of Global Public Health. He has an extensive expertise in the healthcare organization, cancer council, and also implementation science. I take this opportunity to acknowledge both these authors, and in particular chose this book, The Healthcare Management Organization Design and Behavior, 5th edition, based on the credibility of the authors in the healthcare management and their extensive contribution to the global public health. And I also felt that the book aligned with the principles and practice of the Leadership Challenge, 7th edition, written by Professor James Kouzes and Professor Barry Posner. I would like to share my passion of the leadership quality of motivation and engaging leaders. I would like to share an example of balancing professional autonomy with organizational goals. One of the challenge that was highlighted in this book was a healthcare professional, especially physicians, who value their autonomy to align with the organizational leaders for individual performance and foster broader institutional goals such as cost control, quality improvement, and patient satisfaction. One example that was highlighted where a hospital administrator implemented a new electronic health record system to improve efficiency and data tracking. The physicians initially resisted the change, feeling that this could interfere with their clinical judgment and workflow. The motivational challenge was to engage these physicians professionally by involving them in the decision-making process and showing how the system can support better patient outcomes. The leadership insight, what I have learned, is where the motivational leaders must foster a shared governance and transformational leadership, inspiring the staff by connecting organizational changes, goals, and core values to foster professional identity. The second example I would like to share with my colleagues is significant stress during change management and change process, which then contributes to decreased morale within the organization. Healthcare organizations frequently undergo restructure, merger, policy changes, and all these processes can lead to uncertainty, fear, and burnout among the staffs. One particular example I have cited in this book was during a hospital merger, nurses and support staffs experienced significant job insecurity with shifting roles that led to a decline in the morale and decreased productivity with increased turnover. The challenge was for the leaders to motivate the staff by maintaining a transparent communication and recognizing their valuable contribution and providing emotional support. So the key insight for transformational and adaptive leaders emphasized by Shortell and Kaluzny was emphasizing the importance of emotional intelligence and the supportive leadership is to provide empathy, emotional support, motivation, and navigate their staff during these turbulent changes. The one quality and value I passionately love is the integrity with the transformational leaders. The value of integrity, which I hold very passionate in my heart. Integrity is doing the right thing even when no one is watching. One valuable example I would like to share with my colleagues is during a hospital-wide cost-cutting initiative, a healthcare leader discovered that proposed budget reduction would disproportionately affect patient care in undeserved communities. Instead of quietly approving the plan, the leader advocated for a revised strategy that preserved essential services for vulnerable population. They transparently communicated the trade-offs to the staff and the stakeholders, reinforcing trust and ethical responsibility. The question is, would I recommend this book? On a scale of 1 to 10, I would say Professor Stephen Shortell and Arnold Kaluzny, Healthcare Management, a solid 9. Why? It's deeply insightful for anyone pursuing leadership in healthcare. The book blends theory with real-world examples and applications, making complex concepts accessible, readable, and enjoyable. It emphasizes motivational leadership, ethical decision-making, and organizational behavior, which are all the essential traits for a good quality leader. Why not 10? It's academically dense in parts, in my opinion, which might be challenging for casual leaders and novice leaders like me, and those new to healthcare management. The bottom line, if you are serious about understanding what it makes to lead in healthcare, this is a must read, especially over the summer or any seasons when you can reflect and absorb its lessons. I take this opportunity to thank you all for listening to me and wish you all every success in becoming a transformational leader and an adaptive leader for future to come.